Good morning, everyone. Bonjour à tous. Je suis très heureux d'être ici en compagnie de la ministre Anand,
Dr.
et du
New,
Major Général
and
Fortin.
Major General Fortin.
This morning, I have important news to share on vaccines. From day one of this crisis, our government's top priority has been protecting people around the country. Since March, we've procured billions of pieces of PPE and secured millions of rapid tests, which we have sent to the provinces and territories to get to the front lines. We've also provided tens of billions of dollars to the provinces and territories for healthcare, essential workers, and school safety. We're using every tool in the toolbox to keep people safe and get Canada through the storm. It's been a difficult year, and we're not out of the crisis yet. But now, vaccines are coming. Notre objectif est de fournir un vaccin sécuritaire et
is to have a
efficace
safe
aux
and
Canadiens
effective
le
vaccine
plus tôt
that
possible.
we can deliver to Canadians
Lors de la
as
dernière
soon as
rencontre
possible.
avec les premiers ministres,
During the
le
latest
ministre
meeting with
Leblanc
the premiers,
leur a parlé de la
Minister
nécessité de
Leblanc
travailler
spoke to them
ensemble
about the
avec les
importance of
provinces et
working
territoires,
together,
ainsi qu'avec
of
les
all of us
communautés
working together,
autochtones pour assurer le
provinces,
déploiement
territories,
du
the
vaccin.
federal government, and Indigenous communities for the deployment of the
On
vaccine.
a également annoncé
A
la
week
mise
ago,
sur pied
we also
d'un
announced
centre
the
national
implementation
des
of a
opérations
national
par
center of
l'entremise de
operations
l'Agence de la santé
that will
publique
be run
qui est
by
appuyée par les forces
the
armées
Public
canadiennes.
Health Administration, supported
Fortin
by
dirige
the
la
armed forces.
coordination et la logistique.
General
Et je sais
Fortin
qu'il
is
possède
responsible
le
for
savoir-faire
coordination
dont on a
and
besoin.
logistics, and I know that he knows
We
what
are
to do
facing
in need.
the largest immunization in the history of our country. This is no small task, which is why we have a clear plan. Our government, through the National Operations Centre, has been working with the provinces and territories to ensure that we're ready to roll out vaccine doses as soon as they're approved and delivered. On procurement of these vaccines, Minister Anand and her team have been working tirelessly to secure the most diverse portfolio of vaccines in the world, and today we see those efforts paying off. Canada has secured an agreement with Pfizer to begin early delivery of doses of their vaccine candidate. We are now contracted to receive up to 249,000 of our initial doses of Pfizer-BioNTech's COVID-19 vaccine in the month of December. Pending Health Canada approval, the first shipment of doses is tracking for delivery next week. Shipments will continue to arrive into 2021 with millions of doses on the way. This will move us forward on our whole timeline of vaccine rollout and is a positive development in getting Canadians protected as soon as possible. Pfizer, the Public Health Agency, and the provinces are working together to finalize preparations at the first 14 vaccination sites this week. I want to assure Canadians that any vaccine approved in Canada will be safe and effective. The regulatory process is ongoing and experts are working around the clock. They will uphold Canada's globally recognized gold standard for medical approvals. Le Canada a conclu une entente avec Pfizer pour commencer la livraison
Canada
de
secured
doses
an
de
agreement
leur
with
candidat vaccin
Pfizer
plus tôt.
to receive
Nous allons donc
doses
recevoir
of their vaccine
jusqu'à
candidates sooner.
249
We
000
will be
doses initiales du
receiving up
vaccin
to
de Pfizer-BioNTech
249,000
au
doses
mois de
by
décembre.
Pfizer-BioNTech in
Suite à une
December.
approbation de Santé Canada,
This
les
is pending
premières
Health Canada
livraisons pourraient
approval,
arriver la
but
semaine prochaine
we could receive
avec
the first
10 millions
doses
de
next
doses
week,
prévues pour le
which,
début de
with
2021. Cette
millions of
nouvelle
doses ready,
signifie que nous pourrons
and
prendre de l'avance
we will
dans
be
notre
receiving
plan
them
de
in
vaccination.
2021.
C'est un développement
This is
positif
an important
pour
and
pouvoir
positive
protéger les
development in our
Canadiens
vaccine
le plus tôt
rollout
possible.
plan. This will also allow us to protect Canadians as quickly as possible. The Public Health Agency, provinces, and Pfizer will be working together this week in order to finalize preparations for the 14 vaccination sites. I would like to take this time to reaffirm that you can be certain that any vaccine that is approved in Canada will be safe and effective. The regulatory process is ongoing, and the experts are working hard. Canada is known for its high standards for medical approval and This vaccine will be no exception.
Nous avons aussi des ententes avec 6
We also
autres
have
candidats vaccins,
agreements with
ce qui fait
6
en sorte
other
que notre
vaccine
gamme de
candidates.
vaccins
So,
potentiels est la plus large et
we have
diversifiée
the
au
largest
monde.
portfolio of
En
vaccines
plus
in the
de
world.
Pfizer-BioNTech, il y a
On
aussi
top of Pfizer
Moderna,
BioNTech, we also have Moderna,
AstraZeneca,
AstraZeneca
Janssen,
Oxford,
qui ont
and
déjà
Janssen
soumis leurs candidats
that have
vaccins
sent
à
their
Santé
vaccine
Canada. Nous
candidates to
faisons
Health
tout ce
Canada.
qu'il faut pour nous
We are
assurer que
doing
les
all that we
Canadiens
can
aient
to
vaccin
ensure
et
that
accès
Canadians
à un
will
vaccin
have
sûr et
access to
sécuritaire
a safe
le
and
plus tôt
effective
possible,
vaccine as
aussitôt que les
quickly
doses
as
seront
possible, as soon as the doses are ready.
While vaccines are on the horizon, remember, they cannot protect you if you get COVID-19 now. I know this winter will be hard, especially with the holidays fast approaching. But we're coming into the final miles of this crisis. So let's all buckle down and do what's necessary to keep ourselves and others safe. Over the last few days, we've seen new records of COVID-19 cases in a number of provinces. Hospitalizations are rising, families are losing people, and our most vulnerable are at risk. Just because we're getting closer to vaccines doesn't mean we can afford to become complacent. And on the other hand, just because the numbers are spiking doesn't mean we should give up in despair. Let's keep working together, and let's remember that together we will get through this. Parce qu'on se prépare à l'arrivée de vaccins sécuritaires et efficaces,
We are waiting
il
for
est
a safe
important
and
de
effective
maintenir
vaccine.
tous nos autres efforts.
And in the meantime, it is important to keep up our other efforts.
C'est très clair.
What we need to do
Assurez-vous
is
de
clear.
porter un masque.
Wear a
Lavez-vous les
mask,
mains.
wash your
Gardez vos
hands,
distances.
maintain
Téléchargez
physical
et
distancing,
utilisez
and
l'application
download and
Alerte
use
COVID.
the COVID Alert
Évitez les
app.
rassemblements et ne
Avoid
mettez pas votre
gatherings,
santé ou
and
celle
do not
d'autres
put
à
your
risque.
health or other
Et
people's
ensemble,
health at
on va
risk.
passer à travers.
And together, we will make it through this.
This morning, I also want to recognize that 50 years ago today, the report by the Royal Commission on the Status of Women in Canada was tabled in Parliament. When it was published, this report was a landmark document helping drive progress on gender equality. 50 years later, we've come a long way. But with this pandemic impacting women disproportionately, we're reminded that there is still much further to go. One of the most significant recommendations of the Royal Commission was to take action on childcare. Today, we are committed to moving forward with a universal childcare system. Our government will continue to take the steps needed to build and rebuild a fairer, more equal Canada for everyone. Today, I also want to recognize the news that National Chief Perry Bellegarde will not be running for another term. Perry has been a tireless leader and advocate for First Nations, and I know I am joined by people across the country in recognizing and celebrating his years of devoted service to First Nations communities. We lift you up, Perry. We will continue to work with the National Chief to advance the priorities identified by First Nations, including keeping First Nations communities safe from this pandemic. Finalement, j'aimerais conclure en félicitant Michael Sabia pour son nouveau rôle de sous-ministre des Finances.
Michael
Il fait un
Sabia
travail remarquable en
will
tant
be
que
the
président de la
new
Banque
Deputy Minister
d'infrastructure
of
et je sais que
Finance.
ses compétences nous
He
seront
worked
très
very well at the
précieuses
Canada
pendant que nous
Infrastructure Bank,
rebâtissons une
and I'm sure
économie
that his
forte
work will be
et
useful to
résiliente.
us as we
C'est Paul
rebuild a
Rochon
strong
qui occupait
and
le poste de
resilient
sous-ministre des
economy.
Finances depuis
Paul Rochon
2014
has been
et j'aimerais
the
également
Deputy
le
Minister of
remercier
Finance since
pour toutes ces années
2014,
de
and I would
dévouement
like to
et son
thank him
travail
for all his
exceptionnel
years of
pendant cette
devotion
pandémie.
and exceptional work
Merci
throughout
à
the
tous.
pandemic. Thank you, everyone.
Anita.
Thank you, Prime Minister, and thank you also for mentioning the important report on the Royal Commission on the Status of Women, such an important milestone for us to remember. Depuis le début de cette pandémie, mon
Since the
ministère
beginning
des
of this
Services
pandemic,
publics et approvisionnement
the Department
Canada et moi-même
of
avons travaillé
Procurement
sans
and Public
relâche
Services,
pour
and I
veiller à
have
ce
worked
que les travailleurs de la
tirelessly
santé de première ligne
to
au
ensure
Canada
that
disposent
frontline
de
healthcare
l'équipement
workers
protection
have
individuelle
the necessary
indispensable
PPE
pour faire leur
which
travail. Les
they
provinces et les
need to do
territoires
their
ont
work.
accès aux fournitures de
Provinces and
tests et aux
territories
kits de tests
have
rapides
access
dont ils ont
to
besoin.
the rapid tests that they need. We want Canadians to have access to safe and
my Department of Public
efficient
Services and
vaccines.
Procurement Canada has worked tirelessly to ensure that Canadian frontline healthcare workers have the vital PPE necessary to do their jobs. The provinces and territories have access to the testing supplies and rapid test kits that they require, and that all Canadians have access to safe and effective vaccines. We have ensured that Canadians have access to the supplies and vaccines needed in a hyper-competitive global marketplace marked by uncertainty, volatile supply chains, and shortages of raw materials. It is because of this reality that we continue to pursue an aggressive procurement strategy with a diverse portfolio of suppliers, whether in the area of PPE or vaccines. On PPE, we have procured more than 2.5 billion items of PPE. We've received more than 1.25 billion articles of PPE to date. To be clear, this inventory includes Canada's complete order of more than 20 million liters of hand sanitizer, 90% of the face shields and gowns that we have ordered, and more than 84 million N95 respirators. Millions of made in Canada N95s will continue to arrive for at least a decade. Our unrelenting approach to procurement is also why deliveries of vaccine doses will begin this year instead of next, pending regulatory approval. With up to 249,000 Pfizer doses coming this month, we are ensuring that Canada is well placed to undertake the largest mass vaccination operation in Canadian history. Thank you also to Général Fortin for joining our team in this regard. Throughout 2021, I want to assure you that millions and millions of vaccines will continually flow into this country once they are approved by Health Canada. That has been our procurement strategy from day one. L'annonce d'aujourd'hui nous donne l'assurance qu'il y a de la lumière au bout
gives us the
du
assurance
tunnel,
that there is a
mais
light
nous
at the end of
avons
the tunnel.
encore du travail à
But
faire
we still have
pour
work
nous
to do.
assurer que ces vaccins
We need to ensure
et
that these
fournitures
vaccines
connexes
and
continuent d'être
supplies
livrés et
continue to be
administrés.
delivered
Our goal
quickly.
continues to be to ensure that Canada has the vaccines, logistics systems, and supplies in place to further combat COVID-19. And we will not rest until we climb this mountain. Merci beaucoup, Megwetch. Thank you so much.
Thank you, Minister. We'll now turn to the phone for questions. One question, one follow-up. Operator?
Thank you. Merci. First question, Dylan Robertson, Winnipeg Free Press. Line open.
Good morning, Prime Minister. Are you intending to divvy up the initial Pfizer doses on a per capita basis to provinces? And is there going to be a separate quota for First Nations on reserve or any other Indigenous group?
The NACI, the Immunization and Vaccination Advisory Board, filled with scientists and experts, have made determinations around the most vulnerable populations that need to receive vaccinations in a priority basis. And that is guiding our efforts and our decisions on rolling out vaccines. We recognize the challenges around logistics of the Pfizer vaccine. I've been working closely with Northern premiers and Indigenous groups. We've identified 14 sites across the country where we will be able to immediately start delivering those Pfizer doses because they require 80 below temperatures. So it is not easy to roll them out to more remote locations, but this process will allow us to stand up our processes for delivering and handling this first vaccine as quickly as possible. there will be more doses of other vaccines at later dates on a priority basis for Indigenous peoples, particularly those who are northern and remote. Okay. Nous avons identifié 14
Answer repeated in French.
de
We have
distribution de
identified
vaccins pour
14
le présent,
distribution
pour le
sites for
vaccin,
vaccines
Pfizer.
for the
C'est
Pfizer
tout dans des
vaccine.
grands centres urbains, mais
This is
ça va être
in
distribué
urban
selon
centers,
les priorités
but
établies par
it
le
will be
panel
distributed
d'experts sur
according to
l'immunisation
the
avec
Immunization
les groupes
and Vaccination
prioritaires
Advisory
en
Board.
tête de liste. Mais nous allons continuer de travailler
In line with
avec
their
les
recommendations.
fournisseurs
We
de
will
vaccins
continue to work
et les communautés
with
autochtones
vaccine
et
developers
les
and
communautés
Indigenous
territoires
communities
de
and the
l'Arctique
premiers
pour pouvoir
of northern
livrer,
communities
ce
in order
ce
to
dont ils ont besoin le plus rapidement possible.
give them what they need as quickly as possible.
And Prime Minister, Manitoba has the highest proportion of Indigenous people, and Premier Brian Pallister said that if you give the vaccine to provinces on a proportionate basis, but then make them prioritize Indigenous people, that all other Manitobans would be waiting the longest out of all Canadians for a vaccine. To you, is that a racist comment?
Our work is to make sure that all Canadians get vaccines as quickly as possible. And with the contracts we've signed, with the news we're announcing today, we're well on our way to do that. In terms of distribution, I think all of us understand that getting vaccines first to the most vulnerable people is exactly what we need to do. And that's what we're focused on.
Next question, operator.
Thank you, merci. Prochaine question, Catherine Lévesque, La Presse canadienne. À vous.
Question from La Presse canadienne. Hello, Mr. Trudeau. In your opening remarks, you said that the delivery of vaccines will depend on approval. So I'm wondering
On
if
travaille
things have
très proche
changed.
avec la compagnie
Answer.
Pfizer, évidemment
We are
avec
working
un
closely
vaccin
with
qui doit
Pfizer.
être entreposé à moins 80 degrés.
This vaccine needs to be
Ils veulent
stored at minus
s'assurer
80 degrees.
on pourrait les livrer
And so,
aux Canadiens directement le plus rapidement possible dès
we
qu'ils
want
arrivent.
to
C'est pourquoi
deliver the vaccine to
on a
Canadians as
beaucoup
quickly as
d'espoir
possible
que
as soon as
Santé
they
Canada,
arrive. That is
selon
why
leur indication,
we hope
pourrait approuver
that
le vaccin Pfizer
thanks
cette
that
semaine et donc on
Health
pourrait
Canada
commencer à
will
livrer la
approve the
semaine
vaccine
prochaine.
this week, and we will be
Mais
able
pour,
to
le processus
deliver that
d'approbation,
vaccine next week.
Howard, as-tu un peu
Regarding
plus là-dessus?
the approval process,
Non,
I'll
nos
ask Howard
collègues
to add
de Santé
if
Canada
he has
travaillent très
anything
fort,
to
c'est
say.
sûr. Il faut mentionner que notre système réglementaire est un
Our
des meilleurs du monde.
colleagues at Health Canada are working hard. We have one of the best health systems in the world. This allows us to reassure Canadians that any vaccine that is approved here is safe and effective. That is why we are waiting on Health Canada's decision.
Suivi, Catherine?
Follow-up question?
Oui, absolument. Donc, OK, donc vous n'êtes pas capable de
So,
dire si le processus d'approbation
you
a
can't
changé,
say
mais,
if the approval
et
process
puis en
has
termes de
changed,
chiffres, donc,
but now regarding numbers,
150 000 environ,
150,000 doses, does this mean 150,000 people will be vaccinated in Canada by the end of the
Nous
year?
attendons à avoir 249
Answer.
000 doses
We
d'ici la
are
fin
expecting
décembre,
249,000
au Canada.
doses by the end of
Et,
December here in
c'est des
Canada.
vaccins à 2 doses, donc
And these
effectivement,
vaccines
ça veut
have
dire
2
qu'on
doses.
on va commencer à vacciner
This
le plus de
means
gens possible
that
dans
we
les
will
groupes vulnérables.
start vaccinating the most vulnerable
Thank you.
first.
Operator, next question.
Thank you, merci. Next question, Steve Shear, Reuters. Line open.
Hello, Prime Minister. I wanted to go back and ask a little bit about what Dylan Robertson was asking about before. Can you confirm that First Nations isolated communities in the north will have priority access to vaccines, say, before than the general public in places like Ottawa?
We have worked very closely with the premiers in the Northern Territories as well as Indigenous leaders across the country. We know that they are a priority population and therefore will be part of those initial 3 million doses we're expecting in the beginning of 2021. Those are expected to be a combination of Pfizer and Moderna doses. The Pfizer vaccine, because it is required to be stored at 80 below, has more significant logistical challenges, which is why we are setting up initially 14 distribution centers in large urban areas, but they will be added with more over the coming weeks. Perhaps Major General Fortin can speak to the logistical distribution, including as we get out to further areas.
Merci, Monsieur le Premier Ministre. I would
Thank you,
simply
Mr. Prime
add
Minister.
that the territories have indicated a preference to other vaccine candidates because of the complexity associated with distributing the Pfizer vaccine. So we're very much paying attention to the priorities and making those vaccines available as rapidly as possible once they're approved. In terms of distribution of the Pfizer vaccine, as mentioned earlier, the 14 sites are to be ready by next week. Preparations are well underway. Once we're comfortable with that process, we'll expand deliberately into other areas in close coordination with provinces and territories.
Certainement. En français, je pourrais vous ajouter que les
Answer
territoires
repeated
sont en
in
étroite
French.
collaboration avec les territoires, les Premières Nations.
We are working closely with First
Ils ont
Nations
indiqué une
and the
préférence
territories,
pour un produit
and
qui est
they
un peu plus
have
facile à manipuler.
indicated their preference for a
vaccins.
product that
Alors,
will be easier
on est en train de se
to
concentrer sur
handle.
la distribution des prochains
We are
vaccins.
focusing on the
En
distribution
étroite collaboration
of
avec les
vaccines,
territoires
and we are
et,
working
les
closely
Premières Nations.
with territories and First Nations.
Même chose avec les provinces.
Same thing with the
les régions plus
provinces
éloignées.
for
Maintenant, pour ce qui est de la distribution de Pfizer,
the
on a mentionné la semaine dernière
regions that are
d'ailleurs,
more difficult to
14
reach.
sites.
Regarding
Près de la
Pfizer
semaine
now,
prochaine, on est en train de
we
travailler
have our
sur
14
la préparation
distribution
ensemble avec les
centers, and we are
provinces.
working
Et puis,
to
tout
prepare
est
these
en
sites
ligne
with the
pour pouvoir
provinces,
commencer,
and
lorsqu'on aura la permission,
we
l'homologue,
will be
pour que
ready
le vaccin soit
to
homologué.
distribute
Et puis,
the
à partir de ces
vaccine as
14,
soon
on
as it's
pourra
received the
élargir le
approval.
nombre en étroite collaboration avec
And
les
we will be able
provinces,
to increase the
à mesure
number
qu'on est
of centers
satisfait
with
avec notre état de
the
préparation.
approval of the provinces.
Yes, Prime Minister. Last week you had said that there would be further guidance as to what the priority groups would be, so the people who would first be getting the vaccine. And I guess my question is, will the provinces then be expected to follow those guidelines in the same way that essentially the federal government sets them? So do you expect the provinces to then follow the federal guidelines when they implement the vaccinations?
We've set out through the recommendations of the expert group on vaccine prioritizations, clear guidelines, and it'll be to the provinces to adjust and implement them in a way that is suitable for their populations.
Thank you.
De Radio-Canada. Juste pour comprendre, là,
Question
vous dites
from
que les
Radio-Canada.
premières doses pourraient arriver la
So,
semaine
just
prochaine,
to make sure that I
mais
understand
concrètement,
correctly,
quand est-ce que
you
les
said the first
premiers
doses will be arriving
Canadiens
next
pourraient être
week,
vaccinés?
but
En fait, c'est
when
quoi le
will
délai,
Canadians
là,
first be
entre la
vaccinated? What's the
livraison et la
delay?
vaccination?
What's the timeline between
La
the
livraison
distribution
des
and
doses et la
vaccination?
vaccination, ça se
Answer.
passera extrêmement rapidement. Donc, les premiers
All of
Canadiens
this will
vont
be
se faire
happening
vacciner
quickly.
la semaine prochaine.
Canadians
si on a l'approbation
will be getting
de Santé
vaccinated
Canada
starting next
cette
week,
semaine.
pending Health Canada approval this week.
Livraison et,
Is there a time, Howard, between distribution
Monsieur
and
le Premier ministre, je
vaccination?
pense que ce qu'on m'a indiqué, c'est que c'est relativement rapide.
Mr. Fortin
Un jour ou
answers.
deux.
This should
pour
be
passer à travers
very
les
quick.
étapes de
Perhaps
manutention,
1 or 2
déballage,
days
dégeler
between
le produit, et puis
defreezing
décanter,
the
et puis le
product
mixage. Alors, ça a l'air un peu
and
complexe,
preparing
mais
it.
ça prend,
It seems
c'est
complex,
relativement court pour les professionnels
but
de la santé.
it should be fairly simple for healthcare professionals.
Certainly, and so far I'm okay. Yes, I would simply say that it's a matter of a day or two, is my understanding, based on the fact that once you receive the product, you have to unpack, thaw, decant, mix. So that's a relatively fast process for the health professionals.
Dr. New, you were just at the point that when you look at the actual vaccination of Canadians, it's a very close, obviously, integration between the public health aspects and the logistical aspects. So as Major General Fortin pointed out, you know, the delivery and the decanting and all the mixing and so on, all those technical details has to also then, line up with what, from a public health perspective, is the practical aspects in terms of looking at the priority populations that need to be vaccinated, and depending on the number of doses and when they come, how that's actually going to be operationalized in terms of actually, as you say, getting the doses into people. The other point also that we're looking at from a public health perspective is that not all the doses are going to arrive all at one time. It's going to be sort of a regular stream. And so that's part of the planning process in terms of public health priority populations. What's also practical, what can we do in the early days, and maybe it might be a focus on urban centers or places where it's more, I think, amenable to having those vaccinations take place. And then as we get more and more doses, we'll be able to offer it to more and more Canadians. Thank you.
Minister Anand?
Thank you, Prime Minister. I just want to bring it back to our contract with Pfizer. There are a number of stages that need to be walked through before the deliveries occur. So, of course, I want to stress the importance of approval from our independent regulator at Health Canada. After that, there is the window, of course, for shipments to occur. But before those shipments occur, Pfizer needs to be assured that the provinces and territories are ready, in fact, to receive those doses. And it's important to know that that's the work that Major General Danny Fortin is doing with the Public Health Agency of Canada in conjunction with the provinces and territories. Once we are assured of provincial and territorial readiness to receive, then we will be able to pass the baton to the provinces and territories. So the last kilometer, in fact, is with the provincial and territorial jurisdictions. And we will carry the baton as far as we can along that line. Thank you.
I'm McGregor, CTV News. Prime Minister, a few weeks ago, you came out and said that Canadians are going to have to be prepared to watch citizens in other countries get their vaccine first. Then, I think it was last week, you said it didn't matter when we get to the start line, what matters when we get to the finish line. Now, today, you're kind of pulling a rabbit out of the hat and saying, hey, we're going to have vaccines in December. Did you instruct Minister Anand to go out and negotiate this deal to get a comparatively small number of vaccine doses because you were concerned about the political optics of seeing other countries getting vaccinated first?
We've been working on signing contracts that are flexible enough to get us the earliest possible doses of vaccines since this past summer. This was always an intention that we had, to try and get vaccines to Canadians as quickly as possible, along with our imperative of securing the largest number of doses for Canadians possible from the largest range of potential vaccine producers. When we made a commitment to Canadians that we were going to do everything we could to give them the support and the path through this, we were serious about that. We know that there is a tremendous amount of uncertainty in terms of which vaccines were going to arrive first, which ones were going to be able to be manufactured quickly. These were always built into our process as possibilities. But until we were able to sit down here today and announce firm delivery pending the final approval by Health Canada, we wanted not to get people's hopes up because this is something that Canadians have been looking forward to for a long time, getting to these vaccines and getting beyond that. I will say from a logistical and delivery standpoint, this is the largest mobilization of vaccines in Canada's history, and being able to start with a smaller number and rapidly scale up as the flow of vaccine doses starts increasing quite rapidly. This is a good thing to allow the folks on the ground to be able to deliver certainly this Pfizer vaccine, which has a high degree of complexity in the delivery.
Answer repeated in French. Since the summer, Minister Anand and others have been negotiating with vaccine companies in order to have as many doses as quickly as possible for Canadians. We have already mentioned that we have secured more doses per person than any other country in the world. We have also mentioned that we have a better array of vaccines from different companies. That way, those that are the most effective will arrive quickly in Canada. We also worked with these vaccine companies to ensure that Canada will be receiving them as quickly as possible. I know that this is something that Canadians were expecting, and that is why I am so pleased to be able to announce this today, because we can now say with certainty that this will start next week. It is going to be fairly complex, so that is why it is good to start with fewer doses, and then we will be ready to vaccinate as many people as possible very quickly, perhaps tens of thousands, hundreds of thousands of people every week.
Canadian Press. You say we're getting 249,000 doses by the end of the month. Can you spell out in as much detail as possible who are going to get those doses?
The contract we've recently amended with Pfizer allows for them they engage to deliver up to 249,000 doses to Canada before the end of December. In terms of distribution, next week's distribution will happen through 14 different sites that have been identified across the country, one in each province and 2 in our 4 largest provinces. This is to be able to initially get doses out to the most vulnerable people, but also to demonstrate and to operationalize what is going to be an incredibly complex mobilization of vaccines across the country. It is a gradual process that is going to begin this coming week, next week. But let us remember, at the beginning, there will be smaller amounts of vaccines because we are both standing up our delivery mechanisms, but also because manufacturers are limited in what they are able to produce for this vaccine. The large mass manufacturings will be happening into 2021. But with these 249,000 doses coming in December, we will be able to begin on the most vulnerable populations and make sure that we have the logistical grounding and foundation in place to be able to deliver right across the country over the first months of 2021. Any further additions to that? Anita?
I would just add to those very accurate remarks that we are utilizing our negotiating position, a very strong position with vaccine suppliers. Each and every day, we are in touch with these suppliers in order to ensure that Canadians are in the best possible stead. So in those negotiations, we are continuing to press for the earliest possible delivery dates once Health Canada approval has been obtained. And that is why we were able to secure the agreement with Pfizer announced today. And that is why we will continue to work with our suppliers for the earliest possible delivery dates for Canadians. Thank you.
I would like to just clarify your answers previously to my other colleagues before I ask. Is it per capita then for this first 250,000 doses, or is it based on a province's share of it, the most vulnerable people you want to target, or is it based on the province's readiness to receive vaccines? And if it's based on readiness to receive vaccines, can you talk a bit about what are the conditions that you need to see in those provinces? Because if things go wrong, who's then liable? Have you allowed the companies to waive liability, for example? Are you wearing the liability? Could you speak a bit about that, please?
The decision on distribution to provinces and territories, it was agreed, is going to be done on a per capita basis. For the further complexities, I will turn to the doctor and the Major General. Dr. New.
Okay, maybe I'll start. So yes, we've been having active discussions, with our public health counterparts in the provinces and territories for quite some time, and they're ongoing. So as I mentioned earlier, we have received the advice from the National Advisory committee on immunization, and so everyone's aware of the 4 priority groups, Indigenous communities, healthcare workers, older Canadians greater than 80 years of age starting off, and then moving down to younger Canadians, and then, of course, individuals in long-term care facilities. But as we receive the vaccines, the other consideration we're discussing, and Major General Fortin can speak to it, are the logistical aspects as well as the epidemiology in each of the provinces and territories. Every province and territory might have a slightly different experience, and so how they receive the vaccines and prioritize and actually deliver those initial doses to their populations, I think certainly will be based on their own experience and what they determine is best for their individual context. I think I'll leave it at that and pass it on to Major General Fortin. Liability.
I'll turn to Dr. Minister for that.
You can call me doctor. Listen, I think we have to be very clear that every Canadian who wants access to a vaccine is going to have access to a vaccine, and that vaccine is actually provided free of charge from the federal government. In terms of liability issues, it's really important to remember that in our contracts, we specifically implemented clauses that ensured that the vaccines would not be distributed unless they were approved by our gold standard regulator at Health Canada. And that has been the very important point that I continue to mention, perhaps ad nauseum, because it is the way in which we as a country here proceed based on science, based on the best advice of the scientists before we have this rollout. And so in terms of liability, we are able to hedge, therefore, that liability by relying on the excellent judgment of the scientists at Health Canada.
Merci, Monsieur le Premier Ministre. In terms of logistics, we're in daily coordination with provinces and territories. And with the 14 initial sites, we're closely monitoring their level of readiness. We have agreed on the condition criteria with the provinces. The provinces are really on track to have all those sites ready. We're exercising a dry run this week. Boxes are in the air right now. They left Belgium and they're on their way to the next transit node in the cold chain. They're being monitored. So we will learn. This is one way this week where we will learn how the process will flow if adjustments need to be made. Pfizer will learn just as much as we will because they will make some necessary adjustments. Next week, as indicated earlier, 14 sites ready. We're confident at all levels that we're going to get there with some adjustments as we go over the course of the week and next week, no doubt. But we're confident that we're in a good position to start. We have a good visibility on those conditions, and the training is underway starting tomorrow. And then from there, we'll expand in terms of numbers and expand at scale.
On the question of liability, I think the most important thing to remember is these vaccines don't get approved unless they are safe for Canadians. Health Canada has one of the most rigorous approval processes in the world, and we are deeply watching other countries go through their processes, but we will make our internal, Health Canada will make its own internal process decisions based on what is safe for Canadians. And if Health Canada approves these vaccines, then we will begin to deliver these safe vaccines to Canadians across the country. In regards to the contract signed, there was questions of liability, and Canada has undertaken the necessary measures to ensure that everyone is protected through that. Oui. La décision a été prise par le comité d'experts et le
The decision was made by the expert panel and by the government that the distribution of vaccines will be done on a per capita basis throughout the country for all provinces. The provinces will work regarding the framework on the most vulnerable or on priority groups. But we also need to remember that we are at the beginning of a distribution process, and millions of vaccines will be distributed to Canadians in the coming months. We will be learning how to manage this vaccination process, and it will allow us to vaccinate millions of people per month and perhaps even on a weekly basis. This is good news that we're starting now, but the great news is that this is a beginning that will allow us to move gradually, and we will be able to vaccinate the most number of Canadians safely in the coming months.
Can you just clarify, out of the 249,000, will that be 249,000 people who receive the vaccine, or will that be about half that amount of people who get the shot but they'll get 2 doses? And my question is, I understand the government has a diverse portfolio when it comes to vaccines. There has been more option for Moderna, knowing that it might be easier to transport around the country, especially to remote communities or northern communities. Moderna's never created a vaccine before. It's never scaled up to this size before. How much confidence do you have in Moderna to do that?
First of all, we will continue to work with all vaccine manufacturers on their delivering of supplies. Yes, there is significant unknowns in terms of manufacturing capacity for various vaccines. They have never been made at this scale before, at this speed before. That's why, first of all, the regulatory process needs to be as rigorous as it always is. There are no corners cut by Health Canada in terms of approving a vaccine for safe use by Canadians. On top of that, we know that in building a new vaccine, there would be challenges that certain companies would encounter that others might find an easier time with, which was why we set out to build the most diverse portfolio of vaccines in the world, and we ensured more than enough doses for Canadians through all those different vaccine contracts to make sure that if one company does face greater logistical or manufacturing or health approval challenges than others, we have others that will ensure, other contracts that will ensure that Canadians stand the best chance possible of getting vaccinated and getting through this COVID-19 pandemic as quickly as possible. The Pfizer vaccine is a 2-dose vaccine with a few weeks apart. Part of the challenge of the logistical delivery is to see whether those doses can be properly stored and delivered a few weeks later to the same people. That's what Pfizer as a company is looking for. You can imagine that any responsible company like Pfizer is going to want to make sure that none of their vaccines are going to be wasted through inability to properly store, transport, or administer. Every single dose of those vaccines are extraordinarily precious right now. So they will be looking very, very closely at our ability to do that. So those 249,000 doses to be delivered in December, the vast majority of them, if not all of them, will be 2 doses for a single individual.
Thank you, and that concludes today's press conference.
Merci beaucoup tout le monde.